So the U.S. government has a new plan to pay farmers to help stop the spread of bird flu in dairy cattle. Over the next 4 months, up to $28,000 will be paid out per farm to support specific steps needed to stem the spread of H5N1. Payout incentives will also go to producers supplying personal protective equipment to their workers. The first bird flu infection in cows was confirmed in March in the United States. Since then, the USDA says that more than 40 herds have tested positive across 9 different states. A warning tonight about a new set of COVID variants as well, called FLIRT, and worries about a possible summer wave. The latest data from the CDC showing the FLIRT variants account for 1 in 4 infections across the country. So add to that the growing concerns about the bird flu. The FDA is preparing in case a strain circulating in the U.S. jumps to humans. Joining us live to talk about all of this, the risks, Dr. Vin Gupta, a pulmonary and critical care physician with the University of Washington, also a medical analyst for NBC News. Dr. Gupta, thanks for being with us tonight.
Good evening, Joyce. Thanks for having me.
Well, first, tell us, how concerned should we be about the bird flu?
Well, Joyce, this to me is evocative of the times that we live in. As a pulmonologist, this has been something we've been tracking for over 25 years at least. This jumping of viruses that are common in other mammals. Now, suddenly we're seeing a very unusual thing, bird flu in cows. We didn't expect that. Now, the fear here is, could it adapt and potentially infect human beings? That's the worry. That's why USDA, these other federal agencies are being vigilant and trying to protect dairy workers with PPE, although that's still a work in progress. But this is the times that we live in. Unusual types of viruses, not common in human beings, jumping now from one species to the other. We have to be vigilant, and we have to invest in testing and pandemic preparedness.
So how does it spread? I mean, person-to-person contact is very rare. So how could it happen?
Well, so what we've seen here is that in just the 2 cases in which we've seen a known infection with bird flu in cows, ultimately jump to humans, we've seen that it's been a dairy worker, very close interfacing. But it doesn't appear that cows, other animals, are actually infected through the respiratory tract with flu. It seems like their intestines and their stomachs are the ones really harboring the virus. And so this transmission mechanism is different in animals than we typically are used to seeing in humans, where it affects our respiratory tract, it causes pneumonia, it makes us feel ill with a sore throat. We're not seeing that necessarily. But we're still tracking it. That's where I worry about what's happening with the milk supply. Luckily, pasteurized milk seems completely safe to drink. Raw milk, less so. But it does appear that maybe through liquids or through excretion of milk, that's the transmission mechanism.
So we want to keep that on our radar for sure. There's also concern about FLIRT, this new group of COVID variants, and the possible spike this summer. So what do we need to know and remember about that?
Well, you know, this is in a year from now, Joyce, you and I will be talking about the next variant and the next variant after that. This is what we expect with coronaviruses. Coronaviruses are the most evolving, mutating form of respiratory viruses in the world. We all in the world got familiar with it with COVID-19 5 years ago, but we've long known coronaviruses change. They're a family of viruses, they change. That's what's happening with the FLIRT variants. Very contagious, the most contagious set of coronaviruses. And this form of COVID-19 that has evolved into this family of FLIRT variants, more contagious than what we saw first in 2019. But it's expected. The vaccines are still protective against keeping you away from the hospital, somebody like me, and that's what matters. The vaccines protect against severe illness that doesn't appear unchanged, even though these variants have arisen, these new variants. We should expect more of the same down the road. That's why, especially if you're medically higher risk, Joyce, continue to do the things that we practice and have been saying for the last 5 years: get vaccinated and be vigilant.
So bottom line is, we really can't let our guard down, can we?
Absolutely not. And especially, I think this is on what's your risk profile from a medical standpoint. We have to continue to talk about that. It's not the same for everybody. If you're flying in an airplane, if you're in public transportation, and you're medically higher risk, be especially vigilant. But again, FLIRT doesn't change anything in your calculus. All the tools that we have at our disposal still work.
And it doesn't take a lot to be at higher risk: autoimmune and lots of other things, age, etc. Dr. Vin Gupta, thank you so much for helping us understand all of this. We really appreciate your time.
Thank you.